I do believe, and there's good data to suggest this, that especially since the COVID pandemic hit the entire globe, there has been a rise in mental health challenges in society.
I think a challenge we're having in Wisconsin right now with mental health is that we have kind of two distinct areas of the state. One in urban areas, such as here in Milwaukee, where I am, and then in rural areas where there's just less access.
In working with veterans, we see more and more veterans struggling with stressors day to day. Service members who transition back into the civilian world, that's a huge struggle for them.
Even like peers in medical school, like we're supposed to be top of our class, right? Like we're perfectionists. We're all supposed to be like happy-go-lucky, great, we're doing it, but like that's not always the case. And even in an environment like this, where you have people that are really struggling.
There's consistent data that unfortunately hasn't changed much over the decades, that there's a national shortage of psychiatrists, but also counselors and other mental health professionals in most counties in the USA. And it has to do with a lot of reasons.
I see long wait lists, long wait times for people to get in. And I feel like if we don't have enough access to that mental health care, people who are going through struggles turn into crises really quickly.
And so a big thing that we've been trying to focus on in the mental health profession is not just, how do we best leverage our time to really meet those patients or I should say more individuals who have the highest needs, but how do we encourage our peers, our colleagues who aren't maybe quote unquote mental health professionals, kind of getting them to see themselves in a different light as a peer that can kind of be an advocate for others to really help funnel people who have the highest needs to those services that are currently available in the state.
When I went to the training and saw folks in the training that were just kind of lay people, they didn't have any expertise or experience in helping somebody with a mental health crisis. I feel like they are really helping the community just kind of connect the dots, connect people into care and know what to say and how to do that.
When Dr. Kevin Bozymski, who started this whole thing and planted the idea in my head, came to me and introduced me to mental health first aid, and he came up with this idea about training his cohort of pharmacy students on mental health first aid, we actually had compared it to other very good training programs out there. And mental health first aid rose to the top for us.
They first undergo up to approximately 2 hours of independent work where they kind of learn some basic prevalence statistics, understanding of what is the current state of mental health challenges. They then spend an entire day with 2 instructors who are certified in mental health first aid themselves. And what they do is first kind of give them a essentially algorithm, an approach, a standardized approach for any mental health challenge of, how do you assess symptoms, provide that listening, reassurance and information, and then referrals from there. After that, participants then spend the entire rest of that day-long training applying their skills. So watching different case series, video vignettes, and talking in small groups and really practicing those skills.
And now that I have these skill sets, I feel more equipped. The reality is we're not going to be able to help everybody. But I liken mental health first aid, first training as CPR for the mind.
And we also found that pilot actually encouraged more development of self-care plans, resiliency strategies, to a point where we said, hey, there's something here, and prompted us to look into some funding from the AHW Endowment to expand these initiatives more statewide.
In the beginning, we had 5 instructors and 6 partner schools, which equated to University of Wisconsin Green Bay, University of Wisconsin Stevens Point, Northwest Technical College, Medical College of Wisconsin Central Wisconsin, and our local Medical College of Wisconsin and Freighterts.
I think the biggest takeaway is knowing that everyone can be an advocate, everyone can look out for each other and play a meaningful role in the mental health and well-being of their peers. And on a small campus like this where we have class sizes of somewhere between 20 and 25, everyone knows everyone. All the students know each other very well.
A bunch of us kind of hopped on right away. We were like, oh, this sounds cool. I mean, it's like a day of training, extra things that you don't necessarily get where you can kind of put it up next to like CPR and these other things that we're required to do every certain few years. It's a great way to really just get to know more of like the students in the room, to get to know your faculty too, because you're doing it right alongside them, and really just to be able to learn and grow together.
The HW grant allowed us to expand to community partners. Additionally, Medical College of Wisconsin and Freighter shared widely across all of their departments, and the MCW Wellness also added the classes to their calendar.
Our intention with this initiative was to reach the healthcare workforce of Wisconsin. Originally, that definition was very specific to prescribers and licensed professionals, but we quickly realized there are so many people who either soon-to-be professionals, aka learners, but also support staff and others who are in these clinics and hospitals that may actually be the best contact points for individuals going through a mental health challenge.
Because of my very personal experience with mental health and having lost family members who have died by suicide. So just realizing that this is a skill set based opportunity, I wanted to ensure that I took advantage of it.
Many of the individuals felt so strongly about the training that they encouraged most of their staff to. So for instance, the Medical College Public Safety Department, the director had all of his staff go through the training. We had a mental health clinic in 2 locations in the state have much of their staff go through it. And then we also had a local organization that deals with trauma and military sexual trauma, have the majority of their staff go through as well.
We don't have enough clinical providers to see everybody that needs to be seen, and I think taking this class is really helping train somebody to have not only a connection with somebody that they're trying to work with or help, but also just kind of provide that confidence and that role playing that is seen, that's done in the training to help them kind of work through and talk through what would you do if you came upon somebody who is having, paranoia thoughts or suicidal ideations.
A big part is recognizing the stigma on a variety of levels that can occur with individuals. I think for a lot of people, there is a certain self-stigma where people, just because of the mental health challenge, feel like it's not worth reaching out to others. They worry about how stigma will impact the trajectory of their personal life, their professional life.
Mental health first aid training helps overcome the stigma by calling it out. It calls it out. It calls out the stigma is one of the barriers that people have in getting the care that they deserve.
It really just opens up the environment to be able to have conversations surrounding mental health. And I think that is probably the biggest benefit of the training.
The training then ends with a focus on self-care, which I think is crucial for any mental health first aider, because of course, if you can't take care of yourself, it's hard to take care of someone else.
Currently, we have 694 individuals that have been trained and certified in mental health first aid across the state. They've received tools to feel comfortable listening to mental health challenges, without any judgment, providing that hope and reassurance that so many need, and feeling comfortable to refer them to individuals to seek professional help, thus reducing the stigma across the state.
So the beauty of the mental health first aid training is that once you're a mental health first aid instructor, not a participant, but once you're an instructor, then in order to retain the instructor certificate, you need to train at least 3 cohorts of people every year, which is a maximum of 60 people. So when we started, there were 2 instructors, thanks to the Kern Institute's grant. And now at the end of 2 years, it's 39 and counting.
In the event, each of those 39 instructors can conduct 3 trainings a year. A potential 2,300 to 2,500 additional individuals can be trained and certified in mental health first aid across the state.
That is activating, just every day-to-day Wisconsinites to recognize those signs and symptoms so that we can bring more people into the mental health care space to get the help that they truly need.
Anybody can help. It doesn't have to be within a system, doesn't have to be at the VA. It can just be somebody that you meet on the street or someone you meet at the library who you see struggling. It helps open up that door to talk to them.